Hello, I'm Dr. Michael Gerber for the Medicine Wheel. I've been entrusted with the alphabet of integrative alternative medicine, orthomolecular, if you like. There are many, many different facets to this type of medical practice, and we are solidly integrated with regular medical practice as well. But it's important to hit some of the important facets that the integrative medical doctors and homeopathic doctors tend to pursue. So today we're up to the D's.
Podcasting from the base of Lake Tahoe in the Eastern Sierras comes the Medicine Wheel. We are a group of progressive physicians seeking solutions and enlightenment while surfing the seas of big data and summiting mountains of research in an effort to make the practice of medicine more personal and medical knowledge more accessible, and empower you, the listener and viewer, to be as healthy as possible. Now, the Medicine Wheel.
And the D's, we have to, of course, start out with vitamin D. And vitamin D has many, many aspects, and we've really been learning the importance of it in the last 5 or 10 years, although it has always been a mainstay of medical practice is to measure and understand the importance of vitamin D and making sure people have adequate amounts of D. So vitamin D does many, many things, and it's important to supplement, I believe. And we think that supplementing in the range of sometimes even 5 to 10,000 IUs of vitamin D. Some people like 2 to 3,000. But it's important to monitor the blood levels of vitamin D, 125 hydroxyvitamin D, dihydroxyvitamin D. And it's of interest that people who have more weight, it concentrates the vitamin D in fat cells, and they actually need more supplementation to bring them up into the normal range. The normal range on lab test is 30 to 100 nanograms per ml, and a lot of people think that 50 to 80 is a better range to fall into. So vitamin A does a myriad of things, but one of the things it does is to increase the elasticity of our arteries. And as you know, hardening of the arteries is the number one killer of all civilization, especially Americans. And vitamin D increases nitric oxide, NO. And NO decreases peroxynitrite, which is a terrible free radical damager. And we remember that free radicals are molecules that are missing an electron in their outer orbit, and try to complete that pair of electrons in the outer orbit by stealing an electron from a neighboring molecule and setting off a cascade of damage in the body. So by having less peroxynitrite, it's very helpful. Now, nitric oxide via this pathway also lowers blood pressure. Life extension, from which many of these this data comes from, you can access life extension online and simply look at vitamin D. So vitamin D is more of a hormone than a vitamin. It directly or indirectly affects more than 2,000 genes, or about 6% of the human genome. Vitamin D is directly responsible for bone health. It prevents osteoporosis and rickets, which is vitamin D deficiency, and bone fractures, especially in the elderly. Vitamin D is a cancer preventive for 17 kinds of cancer. It helps prevent prostate cancer, pancreas cancer, breast cancer, ovarian, colon, esophageal, and bladder cancers. So it's very important to have adequate vitamin Ds to prevent the second leading cause of death in the United States, which is cancer. It's interesting that breast cancer mortality increases 75% in vitamin D deficient women, and the cancers were more likely to metastasize. Vitamin D prevents infectious diseases. Vitamin D prevents type 2 diabetes, which is ever more common in our American population. So as we mentioned, increased weight requires increased vitamin D, up to twice as much. Increased parathyroid hormone, PTH, is a sign of vitamin D deficiency. Vitamin D supplements reduce prostate cancer and reduces PSA level increase over a period of a man's lifetime. As we mentioned, it reduced death rates in colon cancer, but it reduces them by 48%. Vitamin D protects against periodontitis, tooth loss, and the supplement supports mesenchymal strength, prevents MS, type 1 diabetes, Crohn's disease, and rheumatoid arthritis. So it's very big in the autoimmune area. Vitamin D increases brain health. It prevents depression and schizophrenia, Alzheimer's disease, and dementia. It also prevents the SAD syndrome, which is seasonal affective disorder, or the winter blues. It improves PMS, premenstrual syndrome, and sleep disorders. It's also great for the skin, and vitamin D improves skin health, reduces wrinkles, and helps to treat difficult psoriasis. Vitamin D supplementation increases or decreases the risk of strokes in the elderly. Vitamin D levels are compromised in respiratory disorders as well. And in the elderly, vitamin D levels fall by 49%. So this vitamin D situation is a global epidemic, which increases dementia risk by 20-fold. It increases brain cell growth and memory and helps remove harmful amyloid plaques associated with Alzheimer's disease. 64% of Americans are deficient in vitamin D. It has also a very positive effect on autism. 25% of parents reported drastic improvements in their autistic children with vitamin D supplementation. Again, it doubles the risk of type 2 diabetes, having insufficient amounts, and vitamin D reduces hemoglobin A1C and body mass, and we all know hemoglobin A1C is about a 6-week measure of blood sugar levels in the body. So it also, vitamin D reduces protein in the urine for proteinuria. So vitamin D is an absolute must for supplementation for all of us, unless you're getting 20 minutes of good sunshine a day, which is very difficult in northern latitudes and for people that have very sensitive skin. Well, continuing along with D's, we'll run down to DHEA, which is dehydroepiandrosterone. And this is a mother hormone for the adrenal gland. And we remember the adrenal sits on top of the kidneys, a pyramidal-shaped organ, and it has a host of hormones. And DHEA is a mother hormone for many of them. DHEA supplementation has been used even in Stanford to reduce autoimmune disorder problems, aging, skin wrinkles, and it's the mother, again, of the adrenal cortex. So it's always good to take DHEA if one takes a little cortisol or other adrenal support. Well, DHEA is another thing that diminishes with aging, so it's a good idea to supplement it. In men, 25 to 50 milligrams a day, and in women, 10 to 20 milligrams per day. Now we go down to DIM, which is diindolylmethane. It's usually included with I3C, indole 3-carbinol. And diindolylmethane is a cruciferous vegetable extract from broccoli and others. And it improves the estrogen breakdown profile to less cancerous ones. It causes an increase in 2-hydroxyestrone, which preserves us against cancer and reduces 4 and 16-hydroxyestrone. We measure this with a Dutch test where we do urine sensitivities 4 times a day of all the hormones and all their metabolites, starting in the morning at 11 a.m., 4 p.m., and before bed. Well, dentistry. This is a huge big D. And we see a lot of very chronically ill people who have run the gamut of doctoring and have been to many, many doctors, and their laboratory is all right and their radiology is all right, yet these people are still sick with chronic mood disorders, brain fog, breast disorders, and people don't really address the teeth. So there's a great book out there called The Toxic Tooth by Thomas Levy, MD, JD. He's a cardiologist out of Denver. And you can get The Toxic Tooth at pubfoxmed, one word, pubfoxmed.com. Now, Dr. Levy also wrote The Primal Panacea, that we talked about vitamin C a couple of podcasts ago. So it helps to avoid the minefields of dentistry. And there are many minefields. So first of all, we have to recall that silver fillings are really 50% mercury, and the mercury comes off into the saliva and breath with each bite of hot food and drink of hot liquid. And this goes into the body, and mercury, of course, is a terrific neurotoxin. And we hope that if you do require fillings to be emplaced, that you use the white stuff, and that is much less toxic. So also chronic apical infections, especially under failing root canal teeth, are important to diagnose. These infections can spread toxic bacterial breakdown products to the entire body and can cause sticky blood. And all these teeth, from the German biological dentistry perspective, are on acupuncture meridians and relate to distant organs in the body. These infections can go to the breast and promote cancer. There are 8 breast teeth, according to German biological dentistry, and you can see toxins from these teeth emanate right down through the neck lymphs and into breast cancer tissue on thermography when you see the heat pictures of the breast. So root canals, the Germans have a lovely expression for root canals. They call them a corpse in the attic, because the tooth is dead. When you auger out the linings of the tooth, you kill the artery and the vein and the nerves and the lymphatics, and the tooth can't defend itself, and so bacteria can stream in. Now, this, of course, depends on the skill of the dentist, and people at dentists that are doing 50 of them a month are more likely to put in a very effective root canal than dentists that do fewer number. So these apical, right at the bottom of the teeth infections, can't really be diagnosed easily with really pan or x-rays. So it's necessary to do a 3D cone beam CAT scan of the jaw bones, the maxilla and the mandible, and then you can turn up these chronic infections. And they can be responsible for lots of chronic illness, again, depending upon which teeth are involved. So that these toxic teeth also cause hypercoagulation in blood and increase risk for strokes and heart attacks. So sticky blood can be caused by toxic infected teeth and infected jaw bones. So it's important to have these evaluated. Well, into homeopathy land now for a minute. We could talk about homeopathic digitalis. Now, we always think of regular digitalis, the old purple foxglove, used in regular cardiology to slow down the heart rate and to help with congestive heart failure. But homeopathic digitalis is good for the opposite: bradycardia, slow heart rate, and arrhythmias, especially jumps and skips that people notice when they go into bed. So at 30C, now remember, in homeopathy, which has been around for 220 years, started by Daniel Hahnemann in around 1800 and before, uses many poisons. So if a person appears to have been poisoned, you take the poison and dilute it infinitesimally to make an antidote to give back to the patient to stop the symptoms. So in this case, Digitalis can be diluted at 30C or 200C or higher levels, and it's great for arrhythmias, jumps and skips, and atrial fib and atrial flutter and heart blocks. So in homeopathy, again, we dilute substances by Roman numeral X, powers of 10, and C's, powers of 100. So this Digitalis at 30C has been diluted 1 to 130 times. So when you have weakness and dilatation of the heart muscles, it's great. Again, auricular flutter and fibrillation, heart blockage with weak and irregular, intermittent, or abnormally slow pulse, and a dropsy. And dropsy is congestive heart failure where the legs swell and patients short of breath. It should be used with great weakness and sinking of strength. Congestive heart failure in the elderly is very good for dizziness with ringing in the ears, tightness of the chest and weak heart, fluttering of the heart, high blood pressure, sense of suffocation, faintness, sensation as if he would die if he moves during palpitations. It can cause great weakness and the patient can hardly talk. Again, collapse, prostration from the slightest exertion. Mentally, it can cause anxiety as from troubled conscience, anxiety about the future, suspiciousness, fear of suffocation at night, slow pulse, desire to be alone, thinking can be difficult, weak memory, again suspicious, and hundreds of more symptoms. So again, homeopathy has been around 220 years. It was the leading form of medicine in the United States until the 1920s. When the Flexner report came out, now Abraham Flexner was the son-in-law of John David Rockefeller of the Standard Oil of New Jersey fame, and began funding drug-based medical schools and help abolish schools of homeopathy, osteopathy, chiropractic, herbology, and naturopathy, and other natural forms of medicine in favor of medicine based on hydrocarbons, oil, and the birth of medicinal drugs all made from oil. So there are many, many D's in the alphabet here, and these are but a few of them, and I hope it's been helpful to review some of this information for you. We'll be back soon with the E's. I'm Dr. Michael Gerber for the Medicine Wheel. Thank you very much.
The Medicine Wheel encourages all of our listeners to subscribe to our newsletter and podcasts as we continue to explore the world of medicine, bringing you up-to-date health and science information. The Medicine Wheel invites our listeners to email us any newsworthy stories or topics they wish to explore further and discuss on the podcast. For more information about the Medicine Wheel, please visit us at our website, www.themedicinewheel.org, and on Facebook, and finally on Twitter and Instagram at The Med Wheel.
In an effort to support access to integrative medicine and functional medicine options for those in need and education for those who need information, please consider donating to Project OmCare, 501c3.org. Please go to our website, www.themedicinewheel.org, to learn more.
Thank you again to all our local sponsors, Grateful Gardens, Lighthouse Coffee, and Dorinda's Chocolates, which represent some of the best organic and appetizing options in the Reno, Tahoe area.
Lighthouse Coffee Shop is a proud sponsor of the Medicine Wheel. We are a family-owned and operated local coffee shop. Our goal as a business and a family is to cultivate community wherever we are. All of our coffee is ethically sourced, organic, and farm fresh. It's roasted in-house daily, guaranteeing you access to the freshest cup of coffee on the planet. We care deeply for our community and everyone in it. We strive to provide you with the best ingredients and most comfortable environment. Come and enjoy coffee with us. We are family, and we would love for you to be part of it.
Gerber Medical Clinic is proud to support the Medicine Wheel and medical education to improve health quality, nurturing the lifestyles of our listening community, enhancing wellness for all. Thanks again to Wired Insights and their talented team for making our podcasting dream possible.
In closing, we would like to remind all of our listeners, if you have a medical concern or diagnosis, you need to see your personal doctor without delay, and if needed, obtain a referral to a specialist. If ever you feel the health issue you have is urgent or an emergency, please call 911 and go to your nearest emergency room. Please do not take any of our physicians' commentary or our guests' opinion as medical advice, and always seek out medical care from fully licensed and appropriately trained medical professionals in your area. The information shared in this podcast is for general information only and should not be construed as medical advice, and understand that no doctor-patient relationship is formed. The use of this information and educational materials linked to this podcast and website are employed at the user's own risk. The content of this podcast is not meant to be used as a substitute for medical advice, diagnosis, or treatment.
This is the Medicine Wheel signing off for this week with a reminder to live, love, listen, and learn.